All right, let's go back to COVID-19. So we've talked about diseases and disease space. Now let's talk about what we're facing. So I talked about how the R naught, the reproductive rate, can vary from close to 0 to about 20. COVID-19 is roughly in the 2.2 to 2 to 3. That doesn't seem like that much, but this is exponential growth. We'll talk about that more in a later lecture. That basically means that one person can infect 2.5, those 2.5 can infect another 2.5, et cetera, et cetera, et cetera, until by the end of these, let's say 8 infectious cases, 8 infections, you can get close to 1,000. Actually, it's 1,500. So at the end of the month with COVID-19, one person could infect 1,500 people. You can change that, of course, because R naught depends on behavior and it depends on certain phenomena. Like this is what's kind of hard about diseases, is that they don't occur in isolation. You become aware of diseases and you might change how you respond. So COVID-19 is early on had a pretty high mortality rate, and in fact can still have a pretty high mortality rate when hospitals get overrun. So the United States, for example, has had 300,000 excess deaths as of the time of this recording. And a lot of people think that it was because of COVID-19. Excess deaths in 2020 compared to the average of the past 5 years. COVID-19 can last several weeks. Actually, there are people that are called long haulers that have permanent consequences, permanent heart damage, lung damage, potentially permanent nausea, faintness of breath and head. With COVID-19, you could be asymptomatic. You can have no symptoms whatsoever and still spread it. Which is why when people say, I feel healthy, it's actually not useful in this particular disease. Those are the people that would hide their zombie bite, just letting you know. And it has an incubation period roughly of a couple of days to a couple of weeks. It's a really weird disease. It's like a grab bag of symptoms. And we now think that it's because it affects your blood and your blood goes everywhere. So the United States had a peak early on where it was spreading exponentially, and then we all got together and acted. And then we got lazy. And then the various governors got together and acted while other countries faced their own growth curves. And then we got lazy again. And that's where we are now, lazy. Other nations, if you pay attention to the European Union back there, that's, about 30% bigger than the United States and has a much broader governmental distribution. There's lots of different countries there. They worked really well early on, and then they got really lazy. And now they're facing a worse case than we are. That said, even though they peaked early on in terms of deaths, it was very scary what was happening in Italy and Spain and France. We took the mantle from them at an extremely hard time when doctors didn't know how to treat some of these diseases, some of these patients. And now we have the most amount of cumulative deaths, even compared to an entire continent, although not compared to the Americas, as we'll see shortly. So you can normalize this to populations, right? The United States has more than 300 million people. The European Union has more than 400 million people. But when you normalize it, you can see that this is a little hard to see because the European Union and the Americas have this basically the same color, but we are neck and neck with Latin America and Brazil until recently. In fact, actually, we're still roughly neck and neck. European Union started off up until negative 200, let's say 10 days ago, were the neck and neck with the United States, but then they tamped down their caseload, and it's only now that they have many more cases than we do. Normalized for population, the United States actually also has fewer deaths than Latin America. I mean, it gets tricky here to think about who our peer countries, who our peer group should be. Is Latin America our peer group, or is the European Union? If we compare ourselves to Southeast Asia that was able to like completely take care of this largely, Africa, Middle East, Western Pacific, a lot of other nations, a lot of other areas took care of this. But are they our peer groups? Who's to say? It's a question, it's a philosophical discussion. So you'll see when you go down into the numbers that the United States and its three waves were not distributed equally. The first wave largely hit the Northeast and didn't really touch the rest of the country. But then the South and the West dominated in the second wave over the summer. And then they started getting that under control, except the South went a little lax. The West has gone a little lax as well. The Midwest really, really never took it seriously enough, and now they are the worst with respect to COVID-19. North and South Dakota, the numbers are atrocious. It's like 5% of the population there has it. But because the the Northeast was hit early when we didn't quite know what we were facing, they also bore the brunt of the deaths early on. And the rest of the country has been trying to catch up in a morbid way, but doctors now have a much better idea of what they're dealing with. And so we have a lower fatality ratio. Let's zoom into Nevada. Nevada is roughly in the middle of the pack. We're, I don't know, maybe 18th in terms of how bad we've dealt with this particular disease. A lot of people in this state just are really, really bad about taking it seriously. It's a tourist state, and so it makes sense. There's lots of people coming in from all over the place. So we're in the middle of the pack in most respects. When we look at Washoe and Clark and Carson, Clark has the worst hit portion of Nevada. Pershing is the least poorly hit. It's got 24 total cases, although it's a very small rural area. So when we compare how we've been doing to other parts of the country, we're comparable, but that's not good. The cases are increasing in 47 states right now at a pretty exorbitant rate. So I'll talk about that more in the next lecture. I just want to wrap this up by connecting it to the climate change section that we spent the past month discussing. I could have started with it, but I wanted to introduce COVID-19 first. So here is, just ignore that other beaker. Here is, there we go. This is the chart I wanted to show. When you compare emissions from before the start of lockdown to after, it turns out that there's a lot fewer greenhouse gas emissions. Just a lot fewer. In fact, some people at the time were commenting that if we had done this, if we just went under lockdown forever, we would hit the targets in the Paris Climate Accord, which is cute. So emissions, that's a good thing about COVID-19. It's decreased our emissions. There are bad things. One of the bad things is hospital use. So when you look at the 3 waves so far, we've had to hospitalize quite a few people in different parts of the country at different times. It's led to extreme strain. And this is really bad in a lot of states. In Nevada, it hit us pretty hard during the summer. It's creeping up a little bit now. In my hometown of El Paso, we are now in our 4th mobile morgue, which sucks. It's a situation where hospitals, which typically operate close to capacity anyway, because, well, for a variety of reasons, including profit, are now overburdened. And that includes risks from natural disasters, right? So like the strain on the hospital system is due to COVID-19, but we need those hospital systems for example, hurricanes. Delta hit Louisiana. We are now in our 28th named tropical storm. It's going to turn into a hurricane. This one won't hit the United States, but it'll hit another part of the world that's also suffering from this. Honduras and Mexico and Nicaragua. And so areas that need those resources to deal with other issues, even car accidents or whatnot, aren't going to have those resources. And climate change is making some issues really, really bad, right? Like hurricanes, 28 named storms, tied for number 1 in terms of most amount of storms in a year, and also got there fastest. Or firefighting, right? So one really troubling aspect of our society is that we use a lot of prison labor. We'll talk more about that later on in this class. We have the most number of prisoners per capita and in raw numbers of anywhere in the world. And for some of them, we use them to fight fires. We pay them way less than minimum wage. And California uses these people to fight fires. When they are released, they can't use any of this experience to get jobs as firefighters. But that's a societal issue. As of now, because most of the big outbreaks have hit constrained facilities like prisons and old folks' homes, residencies, the vast majority of the workforce here is unable to actually be marshaled to fight these forest fires, which are being made worse by climate change. So you can see there are some consequences to all of our various societal failings intersecting this. Well, we'll talk about it more. And then there's neutral. So there's good, there's bad, and then there's these fundamental changes of people deciding to move away from major cities to other parts of the country, because a lot of companies, especially in the white collar world, the information world, have said that they are going to remote work permanently. And that means that we are seeing an outflow from places like Washington, D.C., New York City, Las Vegas, San Francisco, into places like Vermont, North Dakota, Connecticut, Montana. And so that's one of those consequences that's just going to be interesting to keep an eye on. as COVID hits and more people move to suburbs, maybe they're going to be commuting less. Maybe they're going to be producing fewer emissions, or knowing that living in rural and suburban areas is actually less ecologically friendly than the city per capita. It may turn out to be worse for climate change. We'll see how this develops. All right, so we talked about the background. I gave you some background. I told you about germ theory of disease. We talked about climate impact, and we talked a little bit about COVID-19. And we will keep talking about that. That's the large part of this section on public health will be on COVID-19. But we'll continue that discussion in another video. Cheers.